Obsessive-compulsive disorder, OCD. Obsessive-compulsive disorder is a mental health disorder that affects people of all ages and walks of life and occur when a person gets caught in the cycle of obsession and compulsion. Obsession are unwanted, intrusive thought, images, or urge that trigger intensively distressing feeling. Compulsion are behavior an individual engage in to attempt to get rid of the obsession and their distress.
People with OCD may have the symptoms of obsession, compulsion, or both. These symptoms may interfere with all aspects in their life, including work, schools, and personal relationships. Obsession are repeated thoughts, urge, or mental images that can cause anxiety, while compulsion are repetitive behavior that a person with OCD feels the urge to do in response to their obsessive thoughts. Generally, people with OCD can't control their behavior and doesn't get the pleasure when doing them. They also experience tic disorders such as motor tics and vocal tics. Motor tics are repetitive movements such as eye blinking, while vocal tics including repetitive sniffing. The cause of OCD are unknown, but the risk factor can be identified. Firstly, genetics. Twin and family studies have shown that people with first-degree relatives such as parents, siblings, or child who have OCD are at increased risk of developing OCD. Next are body structure and functioning. Imaging studies have shown that differences in frontal cortex and subcortical structures of brain with patients in OCD. And lastly, environment. Patients who have experienced abuse physically or sexually in childhood or other trauma are at higher risk of developing OCD.
This kind of OCD patient is generally associated with germophobia. Germophobia is for those people who can't control themselves from compulsive hand washing. Besides that, because they are very afraid of those germs or bacteria that may contaminate their hands, oftenly they will bring along with hand sanitizer and also antibacterial soap.
Intrusive thought is an unwelcome involuntary thought, image, or unpleasant idea that may become an obsession, is upsetting or distressing, and can feel difficult to manage or eliminate. People with OCD have intrusive thoughts that bother them. These can be thoughts about making mistakes, harming someone, contamination, disease, religious preoccupation, fears of impulses or desires, or just about anything that you might consider dangerous, disgusting, or dirty.
Is called as symmetry OCD. This kind of patient will feeling intense and uncomfortable when there are something they are not aligned correctly. They are become so fixated on position and arrangement. For an example, they will even exert the same amount of pressure on their foot and also same distance between each foot.
Patients with OCD are likely to treat every action as stereotype as state. Therefore, they check everything. Sometimes they check the door over and over again to make sure that it is locked. Sometimes it's deteriorate for hours.
Okay, see you later. Bye.
Obsessive-compulsive disorder (OCD) treatment may not result in a cure, but it can help bring your symptoms under control so that they don't rule your daily life. Some people need treatment for the rest of their life. The two main treatments for OCD are medication and psychotherapy. The first one is medications. Certain psychiatric medications can help control the obsession and compulsions of OCD. Most commonly, antidepressants are tried first. Antidepressants approved by Food and Drug Administration (FDA) to treat OCD includes chlorpheniramine for adults and children 10 years and older, second fluoxetine for adults and children 7 years old and older, fluvoxamine for adults and children 8 years and older, and the last one is sertraline for adults and children 6 years and older. However, your doctor may prescribe other antidepressants and psychiatric medications. The second treatment is psychotherapy. Cognitive behavioral therapy (CBT), a type of psychotherapy, is effective for many people with OCD. Exposure and response prevention (ERP), a type of CBT therapy, involves gradually exposing you to a feared object or obsession such as dirt and having you learn healthy ways to cope with your anxiety. ERP takes effort and practice, but you may enjoy a better quality of life once you learn to manage your obsessions and compulsions. Therapy may take place in individual, family or group sessions.
The purpose for us to choose this disorder is because we want to let more people know about OCD, because any of us might be OCD without realizing it. Actually, OCD can cause harmful effects to our health, such as stress and depression. According to research, the number of people that facing OCD will increase gradually in the future. Therefore, this is the issue that we need to concern about. OCD can happen early in life, starting in the age of 7 to 12. In fact, half of the adults that are facing OCD will show their symptoms when they were child. So this is very important for us to know about OCD. That's all from us. Thank you.